Good evening to one and all present here. I welcome you all to PRAGNAVARIDHI lecture series conducted for first year BMS. Before that, I would like to give a small introduction about Panchajanya. Panchajanya, the divine count of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. All the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in our mind, our organization will work towards establishing the importance and necessity of imbibing Bharatiya culture and accepting our roots and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All these while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharata Rashtra, and values to all stratas of people in every corner of the world. Also, the founders, being Ayurveda aspirants, know the inside out of today's medical field. Hence, we aim to make people aware of this and also try our best to solve this in one go. With this aim in our mind, I would like to welcome you all to Pragnavaridi lecture series conducted for first year students. Today we have Vaidya Sajina ma'am, assistant professor in the Department of Rachana Shareera, SDM IH Bengaluru. Ma'am has completed UG in JSS Mysore and PG from Alva's AMC Moodbidre. Ma'am has published more than 10 papers and ma'am has a teaching experience of 3.5 years. We welcome you to the session, ma'am. Handing over the session to you.
Thank you, Panchajanya. Thank you for the introduction. And once again, thank you for the opportunity. So, a warm good evening to one and all. I'm going directly to the topic. Today's topic is Indriya Sharira along with the skin. So, I'll do a small revision of Indriya Sharira. As per NCSM, it will comes under Indriya Sharira, Kala Sharira, sense organs. All these will may ask for SAQ, LAQ, and MCQ. Total 20 marks. Okay. So we'll move to the definition. So what is Indriya? Indriyam, Indralingam. So what is Indra? Indra is the life or prana. So Linga means it is Lakshana. So the Lakshana of Indra, it is known as Indriya. Again, Chakrapani given one more explanation, that is Indra Shabdena Prana Uchyate Tasyandagadasya Lingam Dishtakyam Indriyam. Here also Indra is Prana and Linga is Lakshana. Here they mentioned Indriya means the signs and symptoms of both life and death. That is Prana, Indra, and Rishta. Rishta is death. So we can tell Indriya is nothing but it is the signs and symptoms of life and death. Coming to the Utpatti, this you already studied in your Padartha Vijnana, very detailed study you have done. But still, the Utpatti, all the Indriyas are originating from the Vaikarika and Tejasika Ahankara. All the Indriyas. And along with in Garbha Sharira they mention, in Atmaja Bhava it is derived. So there are total 11 Indriyas, 5 Jnanendriya, 5 Karmendriya, and 1 Ubhayendriya. This also detailed study you did in already in Padartha Vijnana, but still in Rachana Shareera we required very brief explanation for this. So first we will see what is 5 Jnanendriyas. This Jnanendriya, it is also known as Buddhindriya. And this Jnanendriya, again, one more reference it is there. According to Vakpada, this originating from Kapha Rekta Vahini Shrotas. But according to Susruta, it is from Vaikarika and Tejasa Ahangara. Remember, it may ask as MCQ from where the Indriyas are originating. Along with the, in Garbha Sharira, it is mentioned that is Atmaja Bhava. We will see individually what are the Jnanendriyas and what are the Karmendriya. So, Jnanendriyas are Tatra Chakshu, Shrotram, Granam, Rasanam, Sparshanam iti Panchendriyani. There are 5 Jnanendriyas are there. They are Chakshu, Strotra, Grana, Rasana, and Sparshana. Where it is locating? It is locating into the Shira. Shirasas tad abhidiyade. It is located into the shiras because it is buddhindriyas. Panchendriyas, jnanendriyas, they are buddhindriyas. And what are the karmendriyas? Karmendriyas are again it is five karmendriyani: vak, payu, upastha, pani, pada. These are the five karmendriyas. They are vak, payu, upastha, pani, and pada. So what is the function? Karmendriya means they have to do the karma. So vak will do the vachana, and payu will do the visarjana. Upastha is the harsha or anantana. Then next one is pani for dhana and pada for gamana. So these are the five karmendriya along with its action karmas. Coming to Ubhayendriya, that you already very detailed study you did in Padartha Vijnana, that is mana, all the guna, all the things you studied there, that is mana, Ubhayendriya. Coming to the Pancha Panchaka, so these Panchendriyas, they are five in number. They have five dravyas, five adhisthana, five artha, and five buddhi. This together it is known as Pancha Panchaka. Already mentioned Chakshu, Strotra, Grana, Rasana, Sparshana, they are Panchendriyas. And it has five dravyas, that is five Mahabhutas: Kham, Vayu, Jyoti, Ava, Bhuridi. These are the five dravyas of the Panchendriyas, and it is residing in five places. They are Akshini, Karnau, Nasiga, Jihva, Tokcheti. So these are the Panchendriya Adhishtanas where they are locating. And what are the arthas? What object they are receiving? That is arthas. They are Shabda, Sparsha, Rupa, Rasa, Gandha. And there are five buddhi also. That is Chakshu buddhi, Strotra buddhi, Grana buddhi, like that. Five buddhis are there. So total it is known as Indriya Pancha Panchaka. So this is all about in general what is Indriya. So you know now what is the definition of Indriya? It is nothing but the linga, symptoms and signs of both Indra. Indra means prana, and along with the Rishta, that is Arishta, Arishtas. It is bad prognosis, that is death. Then from where it is deriving? It is derived from the Vaikarika and Tejasika Ahankara. All the Indriyas are derived from there, and some Mahabhutas are, in some Indriyas it is more predominant. But in all Indriyas, all the Mahabhutas are present. Next, according to Vakpada, it is coming from the Kapha and Rakta Vahini Shrotas. And what are the five Jnanendriya, five Karmendriya, and one Ubhayendriya, and what are those functions? Now we'll move to individual Indriyas. First one it is Netra Sharira. This sloka you already studied in Anga and Shadanga and Pratyangas. So Netra is one among the Pratyanga. And synonyms are, many synonyms are there: Lojana, Nayana, Akshini, Chakshu, Drishti, Darshana, Druk. These are the synonyms of Netra. And where it is originating, already I told, it is all the Indriyas are derived from Tejasa and Vaikarika Ahankara. Okay, so Vaikarika and Tejasa Ahankara. So here some all these are derived from these two things, along with some Mahabhutas. One Mahabhuta is more predominant in this Indriya, one Indriya. So here Netra Sharira, it is more predominant with the Agni Mahabhuta. It is derived from Agni Mahabhuta. The sloka is like that: Tejasastu Rupam Rupendriyam. So Teja Mahabhuta, the Rupa, it is coming from the Agni Mahabhuta. Next is this also, already I told this also, it is derived from Atmaja Bhava. Indriyani, Jnanam, Vijnanam, Ayuhu, Sukha Dukkadikam cha Atmajani. These all are Indriya, Jnana, Vijnana, because Indriya, it is Jnanendriyas, Panchendriyas, Buddhindriyas. So these all are derived from Atmaja Bhava. Coming to the Bahirmuga Shrotas, this Netra, it will comes under one among the Bahirmuga Shrotas: Ravana, Nayana, Vadana. So Nayana is there. It is one among the Bahirmuga Shrotas, and Alojaka Pitta is present in the Chakshu, and it comes under Tarunasti, that is Grana, Karna, Grivakshi Kosheshu, Akshi Kosheshu. It is coming from the Tarunasti. Next is, it will comes under Mandala Sandhi. This Kanda, Hrudaya, Netra, Kloma, Nadishu, Mandala. Here Netra, it comes under Mandala Sandhi. Mandala Sandhi is present inside the Netra. And there are two pesis, dve netrayoho, two pesis present in the netra, and ashta siras are present in the netra, and there is one avedhi sira, that is abhanga, it should not be puncture. And marma related to netra is avarta and abhanga. Any vidha, any injury to this marma, it may leads to blindness. So this is the small brief introduction about netra. Coming to the netra swarupa, this here mention about the pramanas and the shape and size of the netra. Vidya dvayangula bahulyam swaangushtoodara sammitam. Dvayangulam sarvadaha sa ardham bishak nayana budbhutam. Suvrittam gostanakaram sarvabhuta gunodbhava. Here vidya dvayangula bahulam. Bahulyam means it is 2 angula in depth. And what is the width? It is swaangushtoodara sammitam. One's own thumb. That is the width of the netra. And what is the circumference? It is doyangulam sarvadaha sartham. It is 2.5 angula. That is the circumference of the netra. Bishak Nayana Budbuddha means it is a synonym. Again, Nayana Budbuddha, it is a synonym for netra. And what is the shape of this netra? Suvrittam Gostanagaram. It is circular, Suvrittam. And Gostanagaram, similar as that of the Gostana. And Sarva Bhuta Gunodbhavam. It is made up of all the Mahabhutas, but more which Mahabhuta? Agni Mahabhuta. Coming to the individual pramana, that is Netrayama Tribhagam tu Krishna Mandalam Uchyate. Krishnat Saptamam Ichandi Drishtim Drishti Visharadaha. Here, Krishna Mandala is the 1/3 of Netrayama. Netrayama Tribhagam. That is 1/3 of the Netrayama is Krishna Mandala. And 1/7 of this Krishna Mandala, that is Drishti Mandala. Krishnat Saptamam Ichandi. That is 1/7 of the Krishna Mandala, that is Drishti Mandala. Remember, 1/3 of total Netrayama, that is Krishna Mandala, and this Krishna Mandala's 1/7, that is Drishti Mandala. And also Drishti is equal to the Masura Dal Pramana, and it is formed from the Prasada Bhaga of Mahabhuta. So this may ask as MCQ, Upamana they given. Coming to the Panchabhaudika composition of Netra Sharira, more predominant, that is Agni Mahabhuta, but different parts, different Mahabhutas you can see. That is Palam Bhuvo Agnido Rektam Vatat Krishnam Sidam Jalat Akashat Ashrumargascha Jayande Netra Budbhude. Here Pala means Mamsa part of the Netra, it is made up of Bhumi, Pruthi. Agnido Rektam. What is that? Rekta, that is blood vessels. These all originating from Agni. Vatat Krishnam, wherever Krishna Varna, black color, that is made up of Vata. Sitam Jalat. Sita means white color, it is made up of Jal Mahabhuta. And wherever channels, Akashat Ashrumargascha, Ashrumarga, that is lacrimal apparatus and its passage, total you can consider, that is made up of Akasha Mahabhuta, Jayande Netra Budbhude. Again, that is the synonym for Netra, Netra Budbhude. So Sitam you can take it as Klira, that is outermost white portion, and Krishna is almost corneal, that region you can take. And Rakta, that is all the blood vessels. Pala is the Mamsa Bhaga of Netra. So this is the Panchabhaudika composition of Netra in total. Coming to the Netra Bhagas, what are the 3 parts of Netra? Mandalani cha Sandhischa Patalani cha Lojane Yatha Kramam Vijaniyat Pancha Shatcha Shadevacha. There are 3 parts, Mandala, Sandhi and Padala. Next sloka they mention the number, that is Pancha Shatcha Shadevacha. So first one Mandala, it is 5. Next is Sandhi, that is 6, and Padala, that is again 6. This may ask as MCQ. Remember how many Mandalas, how many Sandhis, how many Padalas, like that. Here Mandala is, it is the circular structure which is seen. Sandhi is the joint or junction between 2 structure, and Padala is the tunics. You can take it as refractive tunics. We will see one by one. Coming to the Netra Mandala, it is Pakshma, Vatma, Sheda, Krishna, Drishtinam Mandalani too. There are five mandalas, five circular regions, mandalas. So they are Pakshma, Vatma, Sheda, Krishna, Drishti. Pakshma, you know, eyelashes. Vatma is the eyelid. Sheda means the white portion, and Krishna is the black portion. Cornea you can take, Sheda you can take it as Sclera, and Drishti is inside, you can take it as retina along with the, where the images form. So these are the five Netra Mandalas. Coming to the Netra Sandhi. So here the junction between Pakshma and Vatma, then Vatma and Shukla, whatever we studied this mandala, in between each circular structure there will be a junction or joint that is known as Netra Sandhi. So here again there are six types of Netra Sandhi. They are Pakshma Vatma Gadaha Sandhi. In between eyelashes and eyelid there is a Sandhi. And next is Vatma Shukla Gadaha. In between lid and Sclera there is a Sandhi. Next is Shukla Krishna Gadaha. In between sclera and cornea. You can take it as limbus. Then Krishna Drishti Gada Abaraha. Last one is in between cornea and inside structures. Drishti. So these are the four, and remaining two are Kaninika and Abhanga. So these are the six Netra Sandhis explained by Sushrutacharya. Coming to the Netra Patala, there are six tunics. There are two which is present in the Vartma, remaining all are present in the Akshi. So we will see what are the remaining four. Two which is in the Vatma, it is in the lead. And in this Patala, you can see the diseases like Timira, etc. And it is very difficult to treat. The first Patala is Tejo Jalasridam Bahyam. It is made up of Teja and Jala, that is outside tunics, outside layer. Next is Teshu Anyat Pishidasridam. Next one is second layer is Pishidasridam, Mamsasridam. And third one is Medasridam, Medastridiyam, Meda layer, the layer which is made up of Meda. And last one is inside, that is Asti Asritam. Last fourth one is Asti Asritam. Remaining two which is situated into the Vatma lead. And all these are 1/5 of Drishti Pramana. So this is all about the Netra parts. So here remember, in total Netra, whatever you studied previously, like Sandhi, which Sandhi is coming in the Netra, which Asti is comes in Netra. Those who are, all these things you already studied in Asti Sharira, Sandhi Sharira and all that you can write. Along with it is one among the Pratyanga, and how many peshis are there, how many like how many siras are present, 8 siras are present, 2 peshis are present. This all you can give a small introduction. Then it is one among the Behirmuga Srotas. This all you can write. Next is its Sorupa and its measurement, 2 angula. It is depth, width, the circumference, all these things you can write. Then the Mahabhuta relations, Palambu, that sloka you can write along with its parts. That is, there are three main parts, that is Mandala, Andalanicha, Sandhischa, Padalanischa, Lojane. Lojane is the synonym for Netra, and it is Panja, Shatcha, Shadevacha, that is 5, 6 and 6. And again it may ask as MCQ, and how many mandalas are there? 5. What are those? Pakshma, Vartma, Sheda, Krishna, Drishti. Like that you can mention. Next is Sandhi. In between these all mandalas, there is a Sandhi. And last one is layer by layer how it is. That is Netra Patala tunics. And there are two in Vatma, and remaining all are present in the Akshi. And here, which disease is possible? Which Vyadhi is possible here? Timira is very common in this area. So this is all about Netra Sharira. And it's very important. And along with it, you can write some clinical correlations like Arma, that is pterygium, Abhishenda, conjunctivitis, Adhimanda, like that. If you want some 2 or 3 clinical anatomies also, you can, or else Timira itself you can write as clinical anatomy, applied anatomy. So this is about Netra Sharira. Coming to the Karna Sharira. Netra, it is more explanations are there in Sushruta Uttara. Karna, it is not having that much explanations. We'll see. First, anyway, it is Mahabhuta predominant. In Karna, that is Akasha Mahabhuta. In Panchapanchaka, we already studied this one. Andarikshaha Shabdaha Shabdendriyam. Sarva Chidra Samoho Viviktacha. So, it is predominant with the Akasha Mahabhuta. Again, Karna also comes on, it is one among the Pratyanga. And Shravana, Nayana, Vadana, Grana. Shravana. It is one among the Behirmukha Shrotas. Coming to the Asti, it is Taruna Asti, Grana Karna, Grivakshi, Kosheshu, Taruna Asti, and the Sandhi type it is Srota Srinkatakeshu Shangavarta. Shangavarta Sandhi, which is present in the Srotra, that is in ear, and there are two peshis present in the Karna, and show two Shabdavahini Sira, which is present and which is Avedhya. Avedhyas are two in number, two Shabdavahini Sira. And coming to the Dhamani, Urdhaga Dhamani, sloga starting itself, the Urdhaga Dhamani, Tadyata, Shabda, Rupa, Rasa, Gandha, like that. So, there are two Shabda, Grahanartha, Urdhaga Dhamani is present. So, this much small introduction you can give about Karna. And the Marma which is related to Karna, that is Vidura. Along with you can take Srinkataka. Actually, Srinkataka, it is the meeting point of Grana, Karna, Jihva and Nasa. So you can take all these four Indriyas, this Srinkataka, but main Marma that is present in Karna, it is Vidura only. Anything happened to this, any Vidha of this Vidura, injury to this Vidura, there will be Bhadidya. And some other Pratyanga mentioned by Charaga, that is Karna Shashkuli and Karna Putraka, that is your auricle, all these things, external structures, that is the Pratyanga told by Acharya Charaka. So this is about Karna. Again, you have to mention first, that is which Mahabhuta, and this Pratyanga Shloka you already studied, that also you can write, and Bahirmukha Shrotas you can write, Astivaright you can write, Sandhi you can write, how many peshis are present, and then which Avedhya Sira it is present, how many Sira and which one is Avedhya, and Urdhaga Dhamani, how many are there, and Marma which is related to Karna, and that Vidura Sloka also you can write here. And along with the, if you want some clinical anatomy like Badidya, Karnanatha, tinnitus, Karnashveda, these things also you can write here. So this is about Karna Sharira. It is only brief description only there. Coming to the Nasa Sharira, same as that of Karna, but predominant Mahabhuta is Priti Mahabhuta. Parthivastu Gandho Gandhendriya Sarva Murta Samoho Gurudacha iti. So here the Mahabhuta is Priti Mahabhuta. Nasa also comes under Pratyanga as per Sushruta. It is one among the Behirmukha Shrotas. There are 9 Shrotas in male and 3 more extra in Trini Adhika in Stri. In that 9, Nasa one among them, Shravana, Nayana, Vadana, Grana, Gudametrani, Navasrotamsi. So Grana is here. Coming to the Peshi, there are 2 Peshis present in the Nasa, and there are 6 Vadavaha Sira, and like Pittavaha, it is present in the Nasa. And coming to the Asti type, it is Taruna Asti, Grana, Karna, Grivakshi Kosheshu in Nasa, then Karna, Grana, Karna, and Akshi. These all present the Taruna type of Asti. And there are 5 Avedya Sira is present in the Nasa. Then Dhamani, it is related same as that of Karna, that is Urdhavahini, Dhamani, Shabda, Rupa, Rasa, Gandha. So Urdhavahini Dhamani, that is Dhwapyam Bhashide, Dhwapyam Gosham Karoti. So the 2 are there, it is present in the Nasa. Coming to the Marma, Srinkataka I told, it is the meeting point. It is not exactly locating into the Nasa, but it is the meeting point of Karna, Grana, Nasa, and Jihva. So you can take, because it is there is a connection, but the main Marma which is present, that is Phana Marma. So any injury to this Phana Marma, it may leads to Gandha Ajnana. Okay. And then one more reference is there, according to Vakpada, Nasahi Siraso Dwaram. While explaining the Nasya, Nasya Karma contest, there he mentioned Nasahi Shirasodwaram. There is a root in between, there is a connection between Shiras and Nasa. That's why Nasya, if we instill the nasal drops, it will reach into the brain. So that also you can add here. Once again, if they ask Nasa Shareera, you can got all these points like the Mahabhuta predominant, and it is one among the Pratyanga. Then this Bahirmukha Shrotas, Asti type, and which marma is related, which peshi, which sira, how many peshis are there, and siras and avetya sira, along with this Nasahi Shirasodwaram also you can write. And clinical anatomy, if you want to write, you can write like penasa, apenasa, like that's some common rhinitis, something you can write here. So that is about Nasa Sharira. Coming to the Jihwa Sharira, here the Jihwa in Amarakusha you can see the synonym like Rasaknya, Rasana, that which is related to Rasa, that is taste. And the Mahabhuta which is predominant here, Jala Mahabhuta, Apyastu Reso Rasanendriyam, Sarva Drava Samuho, Guruta, Shaityam Snehu, Retascha. So whatever the Drava which is present in your body, that is all related to Jala Mahabhuta. So here Jihva is it is more predominant with the Jala Mahabhuta, and there is Eka Jihva, only one Peshi which is present in the Jihva. There are six Siras, Vadavaha Sira. Sira type it is Nava Jihvayam, it is six, it is present in the Jihva. And this Seveni you studied already in Paribhasha Sharira. There are seven Sevenis, Sapta Sevenyaha. Shirasi Vibhakta Panjada, Jihva, Shefaso Regega. There are seven Seveni. In that, five it is present in the Shiras, and remaining two. That is one it is located into the Jihva, and one it is into the Shefa. And it should not be do the Shastra Karma. If you do, you have to take care. Okay, so there are one Sevani which is present in the Jihva. This you already studied detail in Paribhasha Sharira. No need to explain again. Again, this Jihva Utpatti. This again you studied Anga Pratyanga Utpatti in Garbha Sharira. That is Kapha Shonida Mamsanam Sara Jihva Prajayade. It is a Sara Bhaga of Kapha Shonida and Mamsa. May ask us MCQ. Dash is the Sara Bhaga of Kapha Shonida Mamsa. So Jihva is the Sara Bhaga of Kapha Shonida and Mamsa. And there are two Avedya Sira which is present in the Jihva. Again Dhamani, it is the Urdaga Dhamani, Shabda, Rupa, Rasa. Rasa is there. So Urdaga Dhamani also is present in the Jihva. So this is total about Jihva. Again, you can write same. All these except Netra, remaining all are almost same. Netra, little bit explanations are more. Remaining all are almost same. Coming to the Twacha Sharira. So here again the Mahabhuta predominant here it is Vayu Mahabhuta, Vayavyastu Sparshaha Sparshendriyam, Sarva Cheshta Sammuha, Sarva Sharira Spandanam Lagudacha. All the movements, touch, pain, all these things, it is related to Vayu Mahabhuta. So the Mahabhuta which is predominant here it is Vayu. And Utpatti of Twaja, how it is originating, it is when the time of Shukra Shonida, it is metabolized with the help of Ushna, Shukra Shonidasya Apipachyamanasya Pajana, by the Ushna. In that time only the Twaja is forming. At the time of Shukra Shonida combination and it is converted as Garbha, that time only the Twaja will form. It is just like their Upamana is given like Ksheerasyeva Sandanikaha Sapta Twaja Bhavandi. It is as like of Ksheera Sandanika, cream of milk. When you boil the milk, there will be cream will present above, top. Similarly, the Twacha, seven Twajas are present in the body when the time of Shukra Shonda combination. This is told by Acharya Sushruta. We will see what are the seven layers of Twacha. They are, first one is Avabhasini, then next is Lohita, third one is Shweta, fourth Chadurti, Tamra, Panchami, Vedini, Shashti, Rohini, Saptami, Mamsadara. So these are the six layers of Twacha. You have to by heart it in order wise. So first one is better to by heart total sloka, then only you can write the pramana and the diseases which is present in each layer. Adhisthana for diseases, which layer the stigma is present, which layer, like that MCQ may ask, also can ask as SAQ. So we'll see one by one. So Avabhasini, it is the first layer, it will give the reflection. Chaya Pragashayati, and it is Pramana is 1 by 18th of the Vrihi, and the diseases which is present here in this layer, what are the external diseases you can see externally, that is Sitma, Patma Kantaka, these are present in the Avabhasini layer. So remember, it is Avabhasini, first one, Prathama Avabhasini, and it is Brihi Rashta Dashabhaga Pramana, 1 by 8th of the Brihi. And the diseases which is related to Avbhasini, that is Sitma and Patma Kantaka. Ditiya, next one, that is just below the Avbhasini, next is Lohita. So Lohita, it is Shodashabhaga Pramana, 1/16th Pramana, and the disease which is related to Lohita, that is Tilakalaka, Nyacha, Vyanga, Adhishtana. These all diseases which is located into the next layer, that is Lohita. Coming to the third layer, that is known as Shweta, and it is Dwadasha Bhaga Pramana, 1 by 12th of Brihi, and the diseases which is related to this Shweta layer is Charmadala, Ajagalli, Mashaka, Adhishtana. These are the three diseases which is in the Shweta layer of Twacha. Next one is Chadurthi Tamra Nama. Fourth layer is Tamra, and it is Ashtabhaga Pramana, 1 by 8th of the Vrihi, and Kilasa and Kushta Adhishtana. Kilasa Kushta, it is located in this layer. Fifth one is Panchami Vedini Nama. Vedini layer, it is Panjabhaga Pramana of the Vrihi, and the diseases like Kushta, Visarpa are seen in this layer. And Shashti Rohini, sixth layer is Rohini, and it is Vrihi Pramana equal to Vrihi, and there the diseases like Granthi, Apachi, Arputa, Sleepata, Galaganta, Adhishtana. These all diseases are locating in this layer. And last one is Saptami Mamsadara Nama, Vrihi Dvaya Pramana. It is double to that of the Vrihi, Vrihi Dvaya, 2 Vrihi, and the diseases like Bagandhara, Vidradi, Arsha, Adhishtana. Because it is very deep seated, and deep seated diseases are seen in this layer, and it is chikitsa wise it is very difficult. If it is Sitma, Patma, Gandaka and all, we can treat very easily because it is in the Prathama layer, that is Prathama Avabhasini, first layer. So as it go interior, it is very difficult, and the diseases also it is very complicated diseases. So these are the 7 layers according to Acharya Sushruta. So you have to remember the name of the layer and this pramana of the layer and which and all disease it is related to this layer. Coming to the Acharya Charaka, Acharya mentioned only 6 layers. Sushruta mentioned Saptatwaja. Here it is Shatwaja. Sharire Shatwajaha. What are those? There is not exact naming. Charaka mentioned Bahya, Didiya to Asrudhara, like that. So first one is Bahya, that is Udagadara. Next Dutiya, that is Asruddhara, and third one is Sitma Kilasa Sambhavadhishtana. The diseases like Sitma Kilasa, which is present in the third layer, and the fourth layer, which is the Adhishtana for Dadru and Kushta. Fifth layer, the diseases like allergy, Vidradi, Sambhava, Adhishtana, and the last layer, sixth layer, there is no 7 layer in Charaka's version. It is only up to only 6 layers are there. In this 6 layer, the disease like Arumshi you can see, and anything, any injury to this 6th layer, the patient like darkness he can feel in front of his eyes. That means one will be fainting. It is very interior, so anything happened, the total what Tama Darshana will experience by the patient. So this Arumshi, it is where it is like, because this layer itself it is very interior, deep. So Arumshi is just like a boil, and it is mainly it is coming from very deep, and you can see externally also. This is mainly you can see in the parvasu joints, and it is in Krishna Rekta Stula Mula, and it is very deep seated, very big, and it is Krishna Rekta Varna. And the treatment wise, it is Duschikitsa. It is very difficult to treat. Why it is? Because it is very deep seated. So these are the 6 layers according to Charaka, and there are 7 layers. Saptatvaja, you studied already in Sankhya Sharira, Kala Sapta, Tvaja Sapta. So there are 7 kalas and 7 twaja according to Sushruta, and according to Charaka, it is only 6. They are Udagadara Bahya, Didiya Sriddhara, Tridiya Sitma Kilasa Sambhavadishtana, Chaturthi Dadru Kushta Sambhavadishtana, Panchami it is Alaji Vidridi Sambhavadishtana, Shashti it is Arumshi which is present there, it is very inside. If anything, any injury to this 6th layer, the Tama Pravishyadi, that is in front of the eye, it will be darkness the patient will feel. And the Arumshi which is very deep seated, and it is mainly seen in the joints, and it is Krishna and Rekta Varna Sthula Mulani, deep seated and big. So that's why the Chikitsa is very difficult. Edaha Shadangam Shariram Avadatya Nishtishtanti. That means like this, the total skin which is covered with the total body which is Sharira, it is covered with these 6 layers of skin. So this is about the Twacha Sharira according to Sushruta and Charaka. Now we'll see the some of the clinical importance. The last line of Charaka, that is Edaha Shadangam Shariram Avadatya Tishtani. That means it will cover total Shadanga. You can take it as a protection or it is a barrier. Again, it is this also you studied in your Samhita Adhyaya, Trayo Roga Marga. There are 3 Roga Margas. In this, skin is one among this Roga Marga, that is Bahya Roga Marga. And this skin, how it will become very soft, Sukumara and Kledavat, because it will produce the Sweda, then it will become very moistening. And if anything to happen, this Swedavaha Srotas, the diseases like it is related to, mainly related to the skin, like Aswedana, Adisvedana, Parushya of the skin, Adislashnada of the skin, Paridaha of the skin, Loma Harsha. These all will occur if anything happen to the Swedavaha, because Sweda, which is Moolasthana, is Loma Kuba, Meda and Loma Kuba. Meda is nothing but the interior, deepest one, adipose tissue. So anything happen, these all are the Paridaha, Loma Harsha, Parushya, Adislashna, these all will reflect into the skin. Next one is Brajaka Pitta, which is present in the skin and which is help for the paga of the dravya, what you are applying, like what you are doing panchakarmas, or what you are doing applying leba application or parishega, avagaha, abhyanga, these all time such kriyas, we will apply some dravyas over the skin. So because of this pajaka pitta, it will help for the paga. Similarly, it will regulate the body temperature, because Sweda, already told, the Sweda, which the Moolasthana is Lomakupa, like that it will help for the body temperature regulation. And it is one among the Vranavastu, like it is the location. Vrana is which is locating into the skin. And again, absorption of drugs, already told, Abhyanga, all these things we are applying in the externally skin through with the help of Brajakapitta, it will absorb, and there will be a paga. And last, it is one among the Ashtavida Parisha, and through skin you can do along with the Trivida Parisha, Darshana, Sparshana, Prashna, and Ashtavida Nadi. That sloka you already studied in the Kriya Sharira. So you can use skin, the color of the skin, any any external injuries, through this you can do the parishas. So this is in total Sharira. So here you have to remember first which Mahabhuta is predominant, Utpatti of the skin, how the Shukra Shonida during the formation of Garbha itself, it is forming just like a Kshira Santanika. Then next is the layers of skin according to Charaka, Sushruta, and even Vakpada also told same as that of Sushruta. then 7 layers according to Sushruta and 6 layers according to Charaka, and some of the clinical importance like this. So this is all about the total Indriya Sharira. So just go through this total Indriya Sharira. Coming to our next topic, you can expect more here MCQs and SAQs in this Indriya Sharira. So you prepare for that. Coming to our next topic, we have a time limit. So I'll go very fast this topic. Next topic, that is skin. So the skin detailed study already in our system, because very more nerve endings and all are there in the skin. So you did in our system and along with the physiology. Okay, Kriya Sharira you did more. A brief anatomy point I'll explain you. First one is the skin. It is also known as cutis. From the cutis, it is cutaneous word came. And then derma, dermatology. Then in the human system, the skin. It is also the system is known as integument system. So these three terms you should remember. This is related to skin. So why the skin is very important organ of the body? Because the skin has many function. That's why, like thermoregulation, nerve endings are there, then absorption, storage, like that many functions are there, is occurring in the skin. That's why it is very important organ. Along with that, it is covering the entire external surface of the body, including what we can tell ear and tympanic membrane. It is covered by skin. That's why it is very important organ. Along with it is the largest organ and largest sensory organ in our body. So the 16 percentage of the body weight, it is made up of skin only. That is almost 4 kg in weight. And the surface area is 1.5 to 2 square meters. And this thickness, it is not uniform. It may varies from place to place. Some place it is more thick, like your sole, palm, back of your body. But some places it is very thin, like eyelid, penis, labia region. This all region it is very thin. That eyelid is very thin and it is zero point 0.5 millimeter only. So the thickness varies about zero point 0.5 to 3 millimeter. Coming to the next layers of skin, there are mainly three layers. They are epidermis, dermis, and subcutaneous. In general, you can take there are two layers. Subcutaneous is actually it is below the dermis, hypodermis. So in general, you can tell there are two layers, that is epidermis and dermis. Epidermis means above the dermis, and below this you can see the dermis. It is also known as corium or true skin. You will see one by one. So this first one, epidermis, it is epithelial, stratified epithelial tissue, and it is made up of 5 layers. From external to internal, it is stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale or germinativa. These are the 5 layers. And this epidermis, it is avascular. And how it will get the nourishment? Below there is a dermis, and this cutaneous vessels it will reach into the epidermis, and this dermis will give the nourishment, anchoring it will do, and it will the epidermis will get the nourishment, blood circulation. Just below the epidermis, the other layer is dermis or true skin or corium. It is again superficial papillary layer and deep reticular layer. This diagram you can see the arrangements of cells in each layer. The first one, it is stratum corneum. As the name mentioned, corneum, corneocytes are present. They are nothing but dead cells. It is the outermost layer, and most of the cells are dead cells only. The cells are that dead cells. It is known as corneocytes, and the nucleus which is absent here because of the pressure. The nucleus is it is not there. It is absent, and the cell become dead. So it is also known as horny layer. Stratum corneum is also known as horny layer. You can see the arrangement. There are the epithelial layers, how it is, you can see. And just below the stratum corneum, next layer, that is stratum lucidum. What is the meaning of lucidum? Lucidum is clear. The meaning of the lucidum is clear. So this layer, it will exhibit some translucence. That's why it is very clear, this layer. So the name came stratum lucidum. Here also, you can see degenerated nucleus in some cells. In many of the cells, nucleuses are absent. So that is about the second layer. And the third layer, and in first layer stratum corneum, you can see keratin and some type of phospholipids, glycogen, all these you can see in the stratum corneum. The third layer is stratum granulosum. Why the name came granulosum? Everywhere one story is that. That's why the name came. Granulosum means cytoplasm contain granular type of protein. Okay, so that because of that protein, keratohyalin protein, that's why this name stratum granulosum, and it is rhomboid shaped cells. And just below the stratum granulosum, there is stratum spinosum. Here, the spinosum, why the name came? Because it is also known as prickle cell. There is a spine-like projection in each cell, and these projections it will interconnect like one cell to another. That's why it is known as stratum spinosum. And the last layer, that is known as stratum basale or germinativum. In this layer, above superficially it is made up of polygonal cells, and below it is cuboidal or columnar cells, and melanocytes are present. A type of cells are present and which contain the pigment, it is known as melanin, uh, which is help for the coloring of the skin. And this stratum basale, there are many retar ridges are there. From stratum basale, some retar ridges it is coming and it is attaching to the dermis. Through that, uh, this total epidermis will get the nourishment. Okay, blood supply. So that is about the total epidermis. Remember the five layers name and what are present in each layer and what is the shape of the cells in each layer. Coming to the dermis, so here also you can see ridges are there below the epidermis. You can see some ridges, it is going towards the dermis, and in dermis you can see it is highly vascular. Through these ridges, these vessels which will reach enters into the epidermis and will give nourishment to the epidermis. And next diagram also you can see how the stratum corneum, it is horny cell layer, how it is arranging. It is that cells, nucleuses are absent, stratum lucidum. Some cells there are degenerated nucleus, many cells nucleus are absent. Below there is a granular cell layer, granules you can see. Below that there is a spinosum and spines which is interconnect the cells, and last layer above it is some arrangement, below it is another like columnar arrangement. So this is all about the epidermis. Coming to the dermis, it is highly vascular, and you can see the collagen fibers, elastic fibers, and blood vessels, lymph vessels, nerves, everything you can see in the dermis. Where this collagen fibers which consist of collagenase enzyme, this will help for the wound healing, and these elastic fibers which will give the strengthening, and also it will help for the water retention in the body. So many functions are there in the dermis. Again, this dermis is divided into two layers. First one is papillary layer, that is superficial, and below there is a reticular layer, and some muscles like arrector pili muscles, that is a smooth involuntary muscles. When you will get like horripilation, the hairs will ends up. So that because of this arrector pili muscles you can see in that dermis, and some glands like a sweat gland, it will produce the sweat and help for the thermoregulation, and sebaceous gland, again it will produce the sebum which is rich in lipids, and it will moisten the total skin. So these are present in the next layer, and below one more layer is there, that is hypodermis. That is mainly the adipose tissue and connective, it is again collagen fibers and connective tissue. It will help for the skin from too much heat and too much cold. It will help, it will protect the also it will protect the internal structures of the body. That is, if any external injuries, this adipose will help and it will protect these internal structures. Coming to the appendages of the skin, there are mainly nail, hair and hair follicle, sebaceous gland already told, and sweat gland, and one important thing that is highly specialized appendages of skin, that is nothing but mammary gland. Coming to the appendage, that is nail. In diagram you can see there are many parts of skin. It is modification of stratum corneum of epidermis. Modification, again MCQ they may ask. It's a modification of stratum corneum, and sometimes it is stratum lucidum also. Okay, but more like stratum corneum in structure. And this nail has many parts like body, root. Again, this body root is divided into nail plate, nail blood, nail bed, nail groove. Plate you can see externally, and bed is nothing but under the surface of nail plate you can see the nail blood. In the diagram you can see, and there is a skin, and this area there is a groove that is known as nail groove, and eponychium, that is nothing but top of the newly forming nail. Then below that hyponychium you can see. Then nail matrix is there, that is where the growth it is happening. And last one, lunula, also it is there, white crescent shaped area. So this much parts are there. Nail, just go through this. Coming to the next appendage, that is hair. Again, it is a modified part of stratum corneum, and it is covering almost all the body, but some part it is very less, that is palm, sole, and female and male genitalia. In some portion it is the hair is absent, and the parts which is visible to you, that is shaft of the hair, and root you can see inside, and the root has an expanded lower end, that is known as bulb. In this diagram you can see the bulb interior expanded portion, and what you can see above, that is shaft of the hair. And one more hair follicle, that is also a deeper part. And this hair follicle, that is shaft ending portion, and the ending portion of the hair follicle, that is nothing but hair bulb. uh, Coming, two more are there, that is sebaceous gland and set gland. I told already, sebaceous glands are holocrine glands, and it will produce a bump. Set glands are sudoriferous gland. Again, it is eccrine, apocrine. This all you studied detail in your physiology, so you can go through that one. And coming to the color of the skin, I mentioned while explaining stratum basale, the color which is with the help of the melanin, that is a pigment which is present in the melanocyte. If the HB, this color which is depends upon the HB, that is melanin arrangement. And one more it is thing, it is related to the two things are there, melanin and HB. This melanin, if it is more, then the color become black. If it is less, then it is or absent, then the color become white. That condition is known as albinism. This is, there is no melanin. And here one more color change the skin, that is bluish color of the skin, it is known as cyanosis. There is excessively reduced hemoglobin. And one more condition, hemoglobin less, this is excessively less hemoglobin. And if hemoglobin is very less, that condition, one more color it is that is pale color of the skin. In this blue cyanosis, when it occurs, oxygen along with the hemoglobin, it is excessively reduced in your body. So coloring mainly it is depends upon the melanin, and second thing, that is hemoglobin. So remember these two things. And coming to the function, mainly of this is beginning I told, it will cover the entire external surface. That means it will protect, it is just like a barrier. And there is an enzyme, that is lysozyme, which will help to prevent the bacteria and toxic substance entering inside the body. And from mechanical blow and adipose tissue, I told internal structures, it will protect from the mechanical blow. And UV rays, it will protect with this melanin. It has a capacity to absorb these UV rays. Like that, it will protect the skin from ultraviolet rays. And storage function, especially fat, water, chloride and sugar, it will store. And secretion, I mentioned sweat and sebum, that two glands. Absorptive function, like a fat soluble, like ointments and all, it will absorb. Temperature regulation, how it is sweating, the process of sweating there only. And water and electrolyte balance also it will maintain. Mainly the function, chief function is sensory function, that is touch, pain, all these things, because it has many nerve endings and cutaneous receptors. Through this it will help for the sensory function. Excretory function anyway, it will excrete through the skin, like urea, salt and fatty substance, it will excrete through the skin. And also one more important function, that is vitamin D3 synthesis from sunlight with the help of cholesterol. So these are the main functions of skin, and these are the very very important functions in the human body. That's why skin is known as a very important organ in our body. And coming to the clinical anatomy, you can write like skin diseases like psoriasis, acne vulgaris, albinism. Because of melanin is absent or no melanin, that time there will be albinism, vitiligo. This all you can write, like tumors like malignant melanoma and basal cell carcinoma, squamous cell carcinoma. This also you can write as clinical anatomy. And dermatoglyphics is the study of skin pattern which is unique and may be used for personal identification. This is one study related to the skin. It is known as dermatoglyphics, and this also you can write in clinical anatomy. So this is all about skin. Uh, because we have a limited time, that's why I did very fast this total skin. So just go through, any doubt you can ask. Thank you.
Thank you, ma'am. Thank you for this session. And despite being unwell, you took up the session and completed it. From Team Panchajanya, we are very thankful to you, ma'am. Thank you, ma'am.
Thank you, Panchajanya, and thank you, Pradisha. Thank you so much.